First and foremost, thank you so much for joining us today. We're excited to be kicking off Newborn Screening Awareness Month with a number of different webinars this month, with this being the first. Titled Newborn Screening Education, a survey of state programs. And we are so lucky to be joined today by our partners and collaborators at the Texas Department of State Health Services, and specifically the Newborn Screening Program. Ms. Kelly Connell is joining us today and will be co-presenting with me, and you are in for a real treat. Kelly has over 20 years of education experience in a variety of settings, including public health education, both at the school and within the state newborn screening program, and a variety of other roles that she's held over the last 20 years. So we have been so fortunate to collaborate with Kelly and the entire team at Texas on this work. And so thank you again for joining us as we kick this off. Before we get started, just a few quick housekeeping notes. I already mentioned that we will be recording this session, so please be sure to keep yourself on mute while we go through the presentation, and we will have time for questions and discussion towards the end of this presentation. So please do feel free to use the chat box throughout and share any questions or comments that you might have. We definitely want this to be engaging and encourage you all to chat with one another. However, please hold your questions for the end of the presentation, and we will save some time then for that. So without further ado, I wanted to share a little bit about what we plan to cover today. First, we really wanted to set some context and share a little bit more about why this work is important and why there was really a need for developing this specific survey. Kelly is also going to share a little bit more about some of the challenges and experiences that the Newborn Screening Laboratory in Texas has been dealing with, and how that really helped contribute to highlighting the need for this work. We're going to take some time to share with you some of the initial findings from this survey. And again, thank you for anyone that's listening in that participated and shared your feedback through this survey. And we're really eager to share what we've learned and to validate some of the ideas and thoughts around education for families in the newborn screening community that we've been hearing and talking about for quite some time. And then the last step, we'll really, again, discuss and really hope to generate some action, what we can really think about doing and what we can learn from the current successes and the potential barriers that are in place to really think about newborn screening education as a whole. So before I turn it over to Kelly to share a little bit more specifically about their experiences in Texas, I really wanted to help shed some light on how this work came together and evolved. And really what started as an initial shared interest between Expecting Health and Texas was really centered around expanding education, particularly for families during pregnancy, and really starting to think about what it would take at a state program level to start to think about implementing educational efforts for expecting or pregnant moms. And what that quickly evolved into was an understanding that we really need to understand more about what states and what programs across the country are doing. We recognize that, as with many things in newborn screening, there are different priorities and different practices from state to state. And so we really wanted to seek to try to identify and understand what some of those different practices are, specifically around education, both education to providers and education specifically geared towards families. We also understand and recognize that there is an expanding list of conditions that are starting to be added and included on current newborn screening panels. And there's an ever-evolving list of potential conditions that are being considered to be added to panels. So we know that there is a deep need for continued education and really starting to understand and recognize what those needs are. We also, I'm sure many of you are familiar with many of the media articles and pieces that have been seen currently and in the past, and there's certainly a rising concern regarding consent, both around consent for screening as well as the consent process for blood spot storage, which really led us to ask a lot of different questions about what are states currently doing. And as I've mentioned already, just overall an evolving need for different educational needs, and understanding that families and providers and everybody that's involved in the newborn screening system really does have different needs when it comes to education. So starting to put some data to that and starting to put some specific information around these needs was really our aim for this work. So with that, I'm actually going to turn it over to you, Kelly, to walk us through a bit more about some of the specific experiences you all have had in Texas.
Yes, ma'am. Thank you, Mariana, for letting Texas collaborate on this important topic with y'all. Okay, so in Texas, we have recently expanded our educational staff, specifically in the lab, from 1 to 3 full-time employees for newborn screening education. Some of the areas that we have targeted for education include unsatisfactory specimen submission, timeliness of receipt of a specimen to the lab, and appropriate use of the newborn screening cards, for instance, the paid versus Medicaid. For the purpose of this webinar, however, we're going to focus on these last two: educating expectant parents on newborn screening and the retention of residual blood spots. These new opportunities led us to ask how other states are educating in these and other areas. Next slide. We believe educating expecting parents on the importance of newborn screening is a priority. Newborn screening is required under Texas law. A parent or guardian can only refuse the testing if it is against the teachings or practices of their church. Over the last 3 years, we have seen an increase in the documentation associated with the refusals. As you will see here, 2020, we received only 51 refusal forms. 2021, we received 93, but as of August 2022, we've already received 93 forms. So questions we ask ourselves within the lab is parent refusal increasing, or is our documentation and education better? We do not know. But we would like the opportunity to ensure parents understand the importance of newborn screening. Next slide. The other area we have targeted for education is the retention of residual blood spots. By Texas law, the Health and Safety Code, DSHS can retain the residual blood spots for up to 2 years without any consent. They will then be destroyed unless the parent or guardian gives DSHS laboratory permission to keep them, which then they will be stored for 25 years. Uses within the 2 years include ensuring newborn screening test equipment and supplies are working, and to develop new tests for newborn screening and study diseases that affect public health. If allowed to store up to 25 years, they may be used for de-identified public health research outside of DSHS, which may include public health problems such as cancer, birth defects, and other diseases. Residual blood spots have a huge impact on public health, and as such, Texas wants to receive consent to retain all specimens. For newborn screening specifically, the Texas samples have been used by other state newborn screening programs to validate new tests and bring in testing for new disorders. Next slide. In Texas, we must get parental consent to retain the residual blood spots for more than 2 years. This is our parent decision form for storage and use of newborn screening that is included in the collection kit with the filter paper. As you can see, it explains what we are asking for, and there is a place for demographics and a section to check yes or no, and then a parent or guardian signature. Some challenges that we have faced with this is the burden of explaining the form is put on the healthcare provider. The Texas Administrative Code states that the parent decision form for storage and use of newborn screening must be distributed to the parent or guardian by the healthcare worker. The provider shall ensure the completed and signed form is properly sent to DSHS laboratory. We understand there is so much work to be done within the first 24 to 48 hours after a baby is born. This is the part that might get skipped. If the parents are not educated appropriately, they might just mark no, or it might just go in the trash and we never receive it. So if the form is not filled out, such as the parent or guardian did not check either box, it is automatically considered a no. If it is not signed, it is invalid, and therefore it is also a no. Parents are allowed to take the form home and decide and send it back to the lab or take it back to their healthcare provider. We, however, believe the majority do not make it back. Because of these challenges, we are very aware that more education to our healthcare providers and parents or guardians needs to be offered on the use and storage of residual blood spots. Next slide, please. As lab educators, our primary focus on education of the retention of residual blood spots has been targeted at the healthcare providers. We keep track of the number of no's, yeses, and invalid ones, and we look for trends. We have created educational material around this data to send to our healthcare providers addressing some of these issues. We have also made phone calls explaining the process and trying to increase the return rate. In 2021, we received a total of 729,347 specimens. 58.1% of those had consent. 41.3% were okay, and 16.8% were no. We need to educate both healthcare workers and parents about the retention of residual blood spots. With the load placed on the healthcare workers, we thought, what better way to help out the healthcare providers than to just educate the parents or guardians before the birth of their children, which is what led us to reaching out to Expecting Health. We also believe by educating the parents before newborn screening collection will help build trust and a better understanding of the importance of the actual screen and storage of the residual blood spots. Next slide. All this brings me to the survey. This survey will allow us to identify key strategies and opportunities for collaboration to improve education and consent. The key questions included in developing the survey was, do other state newborn screening programs have similar consent forms? Do other state newborn screening programs have similar barriers to reaching families and having forms returned? Have other state newborn screening programs had success with a similar process in the past? If so, what strategies were most successful? The audience that we targeted were the state newborn screening programs, which included the follow-up coordinators plus follow-up program staff, state laboratory directors plus laboratory staff, education staff, state newborn screening program directors and leads, and any other newborn screening program staff. And now Mariana will give you the data, the results.
Yeah, thanks, Kelly. And I think, we talked a lot in preparation for this of how helpful it would be to just learn a little bit more through your eyes and through the experiences that you all have had to navigate, both recently, but also over the years, particularly in Texas. So for those listening in, our intent was that, that in combination with these results would sort of help you think about and probably resonate on some of the questions that you all are talking about in your own labs in terms of consenting families, both for the actual test of the screening test, as well as storage of residual dried blood spots. So for the purposes of today and for time, I am going to keep the results a bit high level. This is kind of an introduction to these survey results, and we are in the process of continuing to evaluate and really interpret what we found. And just to give you a little bit more background of, in addition to the development that Kelly mentioned, how this survey was issued. And again, thank you to many of you who contributed and shared your experiences and feedback through this survey. We opened this survey in mid-April, and as Kelly pointed out, shared it through primarily through the APHL New Steps listserv, but really targeting and reaching out to any newborn screening program staff. It was open for approximately 4 weeks. So it ran from about mid-April to mid-May. And we did send a number of reminders. So we were really, intending and hoping and designing it to where we would have broad representation from laboratories and different laboratory staff members across the country. So I'll go into a bit more detail about what we found. The survey itself was really divided into 3 main categories of questions. The first was really just asking programs to respond and share some of their program characteristics. And much of this data is publicly available through a variety of resources. But as we were designing this, we really wanted to ensure that we were asking these questions specifically of those that were responding to this survey. I will not be going through in great detail all of the information in that initial section, but I will provide a bit of a highlight in terms of who responded and where those responses are coming from. The second section really focused on asking questions related to general practices, successes, and barriers related to general newborn screening education. So these were questions primarily focused on understanding what state programs are doing to provide education about the screen itself. The third and the final part to the survey was really focused on specific questions related to education around consent and storage for dried blood spots. So we'll take this step by step through each of these sections. So in the first section, or rather, we shared this through the APHL listserv and got responses from 44 individuals, 44 complete responses, representing responses from 30 individual states and territories. And what you can see in this map here is that the majority of respondents, there was one response per state. However, we did have a number of states where multiple responses were received. We did also have a response that's not shown here from Puerto Rico. So we feel like we were really pleased with and happy with the range of responses that we were able to collect, and feel like this is, kind of one of the first descriptions of some of these practices and behaviors related to education within the newborn screening programs. We asked participants to select from a list of different roles within the newborn screening programs, and participants were able to select more than one response to this question. So the majority of responses were coming from program directors or program coordinators. We also had quite a number of follow-up program staff that responded, and we also had a large number of directors from state newborn screening programs. So again, what we're sharing here is a broad representation of different roles and different individuals within both the laboratory and follow-up side. And we recognize that for this process, having these different perspectives was incredibly insightful and helpful. Everybody has a different role in education. Regarding the specific educational practices from state to state, we first wanted to validate and assess the number of screens that the state programs offered. And so the majority of respondents come from states that offer one newborn screen. We did have some responses from states that have 2 screens, which is very comparable to what we would expect to see based on the number of states that offer 1 versus 2 screens. We also specifically asked respondents to answer the question, does your program require informed consent, either written or verbal, prior to newborn screening specimen collection? And we saw an overwhelming response of about 80% that said no. Again, not surprising, but written or verbal consent is not required by the majority of states. We wanted to inquire and find out a little bit more about what states did in terms of providing education directly to providers. So we asked for individuals to respond yes or no to the question of, do you have staff dedicated to educating local hospital and or healthcare providers? And we found that just shy of 70% of states do in fact have parts of their newborn screening programs. They have staff that are dedicated to educating hospitalists and healthcare providers. Of those states that said, yes, we do have staff, we do have people on our staff that are doing that, about 82% had somewhere between 1 or 2 of their staff members that were dedicated to that provider education activity. So this is not terribly surprising, it is surprising in the sense that we have a lot of programs that do have staff, but the number of staff that they have is not a lot. So if you do have staff that is dedicated to provider education, it's usually a smaller number of staff members that are dedicated specifically to that. We then switched gears and wanted to find out, in addition to provider education, do you also have staff that are dedicated specifically to parent or family education? And this is where, things started to change a little bit. So unlike provider education, the majority of state programs that responded do not have staff that are specifically dedicated to parent or family education. So in this case, over 70% of programs responding do not have that staff. Of the roughly 23% of states that do have dedicated staff, again, it's only 1 or 2 staff members that are specifically dedicated to parent or family education. And we're not able to decipher from the data that we have whether those 1 to 2 individuals are the same individuals that are also providing education directly to providers, or if those are unique or different staff members. Our assumption is that there's probably some overlap and that those could be one and the same individual. We wanted to find out a little bit more about when state programs are providing education directly to families. And this is really interesting, maybe not so surprising to many of you, but the majority of respondents and the majority of laboratories indicated that most of the education is occurring either right after birth, before results, so at that time of screening, or immediately at the return of results. What this pointed out to us was exactly, as Kelly mentioned, our primary reason for really starting this work together. This presents a pretty big opportunity to think about education across the spectrum, including educating and informing families about newborn screening prior to their delivery. And it was also really interesting to us that not an insignificant number of respondents weren't exactly sure when newborn screening education was happening, which just points to the fact that the labs themselves are not necessarily those that are educating the families. It's really relying on healthcare providers and hospital staff that are doing that. So it's not exactly clear to those individuals when that's happening. Which brings us to our next question. We really did want to assess and seek to understand kind of how and through what methods is newborn screening education happening. And again, this is specifically asking, how does your program educate parents and families about newborn screening? And as predicted, the majority of education is really relying, the state programs are relying on hospital staff and providers that are in the sites and clinics that are sending newborn screening in to rely and to do that education. So over almost 75% of respondents deliver newborn screening education through a provider or hospital staff. So it's not the lab itself, but relying on those partners through the healthcare systems. We asked to share or have individuals share what specific engagement activities they're utilizing within their programs to educate families. And the majority of respondents shared that either a website or a brochure was their primary source of education. Again, this is not a comprehensive list or an all-inclusive list. This was a list that we created and allowed individuals to choose more than one response to. So you'll see a number of different responses across the board, but primarily brochures and websites seem to be the most used tool for delivering education. However, we also saw that there were some other methods, educational videos, phone calls, webinars such as this, were all different sources of engagement directly with families. And you'll see in just a moment when I share some of the successes, some of the unique ways that some state programs are engaging directly with families to provide education. Again, we asked to share a bit more about what specific topics related to general newborn screening education many of the programs are providing. Most programs, and you'll see on the left-hand column of this bar chart, that's the number of respondents. So many of the respondents are shared that they are explaining or providing information and education regarding the benefits of newborn screening. Most programs are providing some education and information around the disorders that are screened, the timing in which newborn screening is completed, how it's done, and what to expect from the results. And again, we know that this is not everything. We know that labs are providing education on other areas as well, but these were the most prominent topics that most state laboratories are providing education on. We also wanted to gauge how laboratories and programs feel specifically about the importance of newborn screening education for families and where that falls in the priority of other tasks and activities that are the responsibility of state programs. So with regard to the question of how important is education to you as a program, over 88% of states that were responding reported that it's extremely important or very important. So we know that to state laboratories, there's no question that education, and specifically education to families, is an important topic. We then asked for respondents to share how much of a priority is education. And a little bit lower there, with 51% of respondents report that parent and family education, specifically of newborn screening, is a high priority in their program. We wanted to then follow that question up with some insight and input on how the funding matches the priority level. So we asked a specific question: does the amount of funding and financial support match the priority level of your program? So we know that the priority level is high. We know that labs feel it's extremely important, but what was very interesting to see is that over half of the programs responding feel that the financial support does not match the priority level of education. So we recognize immediately that funding and finance and being able to educate and have the tools in place to do so are a barrier for many of the programs that are responding to this survey. We wanted to get a sense of, pardon me, how many active projects laboratories might be working on related to family education around newborn screening. So we asked individuals to respond if they have many active projects, if they have a few, if they're in the process of perhaps implementing specific projects, or if there might be in the planning phase. And you can see from the data on the right that some programs, just under 40%, do have a few active projects. So we were pleased to see that there are, we know that many labs are working very hard on educational activities of different kinds. But we also saw that for the barriers that we'll talk about, there's probably a reason why many states are either in the planning phase or not currently planning specific educational activities for families. So I know this is a bit of a busy slide, but wanted to share with you some of the specific activities that respondents shared as successes when thinking about creating and delivering parent or family education. One state responded, they had a campaign where they shared, or where they created rather, newborn screening Band-Aids for every newborn screening in the state. And those Band-Aids were used at the time of screening as a way to raise awareness for the importance of newborn screening. That particular state also has a family advisory group as a way to engage directly with families. We also heard from states that different community events were hosted, such as even attending and hosting large baby showers for expecting and pregnant moms to visit and learn more about various different prenatal needs. There were community health screening events that were mentioned, and a variety of other public health events with health nurses. We mentioned this earlier, but specific brochures to parents were shared on the importance of newborn screening and the specific conditions that are screened within that state. Statewide conferences, and including a parent panel, was one particular activity that was shared. And certainly, again, this is not everything that was shared, but just to give you a sense of some of the particular successes that we heard states share. We've also heard some successes regarding brochures and billboards and specific newborn screening ads throughout bathrooms. And this is something I know I have heard other state labs talk about as well, but creating posters and different informational things that can be posted in various well-trafficked areas within clinics and hospitals. So all of these have been very unique and specific examples that our respondents have shared as successes. Likewise, there were, I know this list looks shorter than the successes, but I think we heard a lot of the same responses over and over regarding the barriers to newborn screening education, specifically for families. And we heard states repeatedly talk about just the challenges with the lack of staff, and in particular turnover for staff. So as we shared in the earlier data, we do know that not all state labs have staff dedicated to provider and patient education. And for those that do have dedicated staff, it's not a lot of staff. So this definitely presents challenges to states as they try to think about how to best engage families, what education to provide, when to provide it, and kind of balancing all of those needs. Language and cultural differences have been a challenge. I think we all recognize that not every person throughout a state receives education in the same way. Education is a very broad category, and not all families learn in the same way. So really thinking about what are the biggest needs across cultures and across languages, and how to best address those has definitely been a challenge for many states. We talked about this already as well, but lack of staff and funding are certainly a very well documented and highlighted challenge for states as well. And I think what this data has definitely shown us is that laboratories, we know that laboratories have a lot of competing priorities, but when really asked to respond to these questions and highlight, how are you delivering education? How are you consenting? It just points to that is a sliver of what labs are having to manage and facilitate. And so really thinking about where education fits when there's a number of priorities that labs are balancing. So in this last section, I'm going to shift gears just slightly and share a bit more data specifically to education for families related to residual dried blood spots. And a lot of the questions were asked in a very similar manner to the general questions or the general education of newborn screening, but really wanted to parse out and specifically ask what states are doing around dried blood spot storage, education, and consent. So we asked programs how they obtain consent for dried blood spot storage. And really, specifically, how does your program obtain consent for dried blood spot storage? Excuse me. Only 2 states require written consent for the storage of dried blood spots. No states responded that they require a verbal consent, which means that the majority of states that did respond do not obtain written or verbal consent and really rely on an implied consent for blood spot storage. We again asked the question of, do you have staff? Do you provide education, excuse me, not staff, do you provide education regarding residual dried blood spots to families? And 46% of states indicated that yes, we do provide education to families in some manner. And then of those that said yes, we do, the majority of the education is coming from different providers or hospital staff. So whether it be a prenatal provider, whether it be a hospital provider or a pediatric provider, most of the education specifically around dried blood spots is also coming from those providers and not directly from the newborn screening program. We also asked about some of the particular educational activities that are being used to inform and educate families specifically about dried blood spot. And again, brochures were overwhelmingly the most used method of education, followed by websites. And more than likely, those are similar or the same brochures that include information both about consent and process of screening, but also dried blood spots. So we can't quite decipher if it's unique or different education. So our assumption is that it's really, a single brochure or website that has information on all of these activities. And then some of, again, the successes and barriers that were shared specific to dried blood spot storage were a little bit different than the general newborn screening education. It was interesting to see. I think this is an area of opportunities that labs have been thinking about, but are thinking about in new and different ways, just given the evolving needs of newborn screening. And we heard many labs or saw many labs respond with, we don't know that we've had a lot of successes in this area just yet. We also know that not a lot of labs, based on the data, are requiring consent for dried blood spots. So while there may be information shared in a brochure or website, there's not a lot being discussed at this point by the state labs around dried blood spot collection and storage. So we haven't quite yet uncovered what the successes have been. Those that have had some successes have shared that a tear-off informational sheet on the blood spot collection form has been successful and helpful. And again, kind of leveraging some of the already in place educational tools like brochures and websites to expand on that and start to think about including information about the storage and retention of dried blood spots. So that is, again, I know I went through kind of a high level of what some of the initial data has been and what we've seen in the responses and collection thus far. And we do hope to continue to analyze and really dig into the data a bit more. But based on what we've seen thus far, our key takeaways really, and what this highlights and validates some of what we've been, again, talking about for quite some time now, is that really state programs have a primary focus when it comes to education on educating their providers. There tends to be more staff in place to be able to do that, though it's not universal across the board. And so, and also recognizing that such a large amount of education for families is really facilitated and done through the providers themselves, it makes sense that laboratories have quite an emphasis on ensuring that those who are collecting specimens, those who are meeting face-to-face with families, really are informed and able to provide education directly to families. But that leaves a really big opportunity for state programs to, think about, are there ways that states can also be involved in direct-to-family education? We've learned from this and highlighted from this that programs definitely feel like family education is important. They want to be doing that, and it's a priority. However, because of the many barriers that were outlined, there's a lot of things that prevent this from really being routine or occurring on a regular basis across laboratories. So those competing priorities, the limited staff and funding, and high staff turnover have made all of those things quite challenging for labs. And I know I'm saying that, and many of you may be nodding your heads and living this on a day-to-day basis. So I certainly don't want to speak for you, but just recognize what we heard from these responses. We learned again and validated that we know brochures and written materials are a way of educating, but we also know that the needs of families are evolving and the needs of newborn screening systems are evolving. And so it really presents an opportunity for rethinking, what does education mean? Who are we really trying to educate? And what are the most current and best ways to receive and deliver that education to the families that are going through newborn screening, and really thinking about opportune times to do that, particularly as conversations and needs evolve around dried blood spot storage. And then last, but certainly not least, we heard loud and clear from the survey that there is a desire, states desire to have support to deliver direct to family education, but knowing that that focus and that priority really is falling to providers, what can we do as a newborn screening community to help states be able to deliver that education directly to families? So what are some next steps that we have planned? And as I said, this is just the beginning. We're kind of just letting this data settle in, but we do hope to do some additional analysis and reflection. We hope to hear from you what you all see as opportunities. We do plan in the next few months to facilitate some discussion groups to further explore and collect insight. If that is an area of interest for you, or if you are listening in and you would like to be a part of those discussions, we would love to have you. I think, as with any survey, this has generated even more questions. And so being able to speak directly to all of you who are doing this on a daily basis and really understanding what some of those barriers truly are, I think that would be an incredible opportunity, and we would welcome you. So please feel free to reach out to us directly. And then, I think we all have an opportunity based on this to recognize that there are places where educational tools that are already in place can continue to be shared and emphasized, and really leaning on one another of what has been successful in certain places may also be successful in others. And what hasn't worked, what can we learn from those challenges? So the last thing I'll share before we kind of open it up for discussion and questions is one very specific opportunity for states and for families to access some resources related to newborn screening education. And through the Newborn Screening Family Education Program, we have developed a resource toolkit, which includes a significant number of family education tools. There are video education tools, There is a booklet specifically for expecting and prenatal moms that can be accessed through this toolkit. There are online training curriculums that can be shared both for families that are newer to newborn screening, as well as families who may be further along in their newborn screening journey and are seeking to understand more about newborn screening as a system. So there really are a number of different tools that can be accessed and shared through this toolkit. We welcome you all to use that, to share that. And if you have any questions, please do not hesitate to reach out to us directly. And then in addition to this, of course, there is a wealth of information on a number of different resources, including Baby's First Test. The Texas Department of Health has a number of resources on their newborn screening website. And I know many of you on your own websites have additional information as well. So please be sure to share what would be helpful and useful for other laboratories to rely on as they think about sharing with families. And with that, we welcome any questions that you all have. We would love to open this up for a time of discussion and comment. We welcome and encourage you to unmute yourself and ask or share your comments if you have them. We also encourage you, if you don't feel comfortable doing that, to please feel free to use the chat box. And with that, thank you.
Hello, everyone. So I have two questions here. We had one from registration, and they were stating that they're curious if states including information about retention of blood spots, in parent brochures is a part of parent education.
Say that, sorry, can you ask that one more time? Is the brochure and website part of parent education? Is that the question?
I guess if including info about the retention of blood spots in parent brochures, is that a part of parent education?
So, and Kelly, please feel free to jump in here. Based on what we collected, so in the data that I shared that showed brochures, that is one way in which many laboratories are sharing and providing education. I think that lends itself to a larger discussion of, do we think that brochures, I think it is one way of education, but that may not be the only way of education, particularly for families that may not learn from a brochure. But I do think that many laboratories that responded are using the brochure as a way to include information specifically about retention of dry blood spots.
Okay. And another question is, in the development of the survey, was there any discussion about the end goal of educating families? Is it for them to just know about newborn screening or know what to do with an out of range result?
It's a great question. Kelly, do you want to answer that first, and then I'll jump in?
My thought is that it's everything. We want them to be knowledgeable about the collection. At what point for their state should they be collected? You know, a lot of parents don't realize Texas is a 2-screen state, and your baby's first screen is done when they're 24 hours to 48 hours old, and then again 2 weeks old. So we also want them to understand the abnormal, because that's a scary call to get. You know, if you get that call and you're not aware of what that call is, and maybe you didn't even know you had this screen done. So, you know, we do think that it's from the very beginning to the very end, education is needed across the board for the parents and families.
Yeah, I couldn't agree more. And I'll just add that the specific goals of this survey really were more to understand and document and highlight what the practices of education are, what the successes have been, and what the barriers are. So I think that's very different than kind of what is the end goal of education. And so our hope was that we would be able to gather and validate some of the information that we've been thinking about, and we talk a lot about in the newborn screening community, and then take that and ask that very important question of, okay, now we know this is what's happening. These are the practices. What is our end goal of education? That is such a big word. when we think about what that could or could not incorporate. And to me personally, education consists of communication as a huge part of that as well. And so now that we kind of have this foundation of data, that's part of the next steps. What is our end goal? What does it truly mean for a family to be educated? How is the best way to do that? And kind of building out next steps and plans to answer those very, very important questions.
Thank you.
Yeah.
And the next question is, do you provide the parents with the refusal form, or do the hospitals have a standard form that they use?
If you're referring to Texas, the refusal form, it's only refusal for the consent to store the blood spot. So if you remember Texas, you cannot refuse the test itself unless it's for religious reasons. And in that case, if you're talking about that, we do have a form that the providers give them if they want to, if they have religious reasons that they do not want to have the screen performed. But for the consent, it's included in the kit. It's this little package, and it, you know, it's got the demographics and it has the consent to store form all in one. And it is written in our law that it is up to the healthcare provider to provide that form to the parents. It doesn't always get given to them. So.
This is Amy. I just want to expand on that. So our form is a standard form. Sorry, this is Amy Slaybach from Texas. The form that we have published that we ask providers to use when there is a refusal for newborn screening, we ask that the demographic information be kept in the medical record for the retention for that facility to take, to have ownership of that. All that we receive here is theoretically the submitter information. So we'd like to know, we're for our own purposes, we're trying to figure out where these refusals are happening. Is it related to, a specific area of the state of Texas where there is, a certain religion that doesn't, is not in line with newborn screening, and those types of things to help us try and target education as we receive those newborn screening refusal forms or refusal to have the screen done. And I don't know if that answered the question or not. Oh, wait, So Shane, did I answer your question?
Okay.
Okay.
Yeah. Looks like yes, Amy. Thank you for that.
And someone said this information is so important and deserves to be published. What are your plans to publish this data in a peer-reviewed journal?
That's a great question. No, it really is. And I definitely think that's part of the next steps that need to be defined. I think that was part of our original goal in doing this as well, is that, we really wanted to contribute to the body of data that is lacking in newborn screening. And when we talk about funding being an issue, it's really hard to describe successes of education. Doesn't mean they're not happening, and it doesn't mean that they're not impactful, but sort of really thinking about, we know that this is a priority. We know that labs think this is important. We know that labs don't have the funding or support to do this. What is it going to take to move us in a direction where we can start to provide more family education at the state level? And so, I think we definitely are thinking about how and where and what would be the best next step in terms of sharing this data. So more to come on that, but definitely agree with you that it's important, and we would definitely like to share it.
Okay. One more question just came in.
Sure.
Was this a special instance, or does Expecting Health do this type of partnership with other states or groups, such as helping develop surveys or advising on education strategies, etc.?
Yeah, it's definitely something that we do. We, through a variety of our different programs, we focus on, helping co-develop and partnering. And so if that is an area of interest for you or a need for you, absolutely, please feel free to reach out to myself directly or to Expecting Health. And we'd be happy to connect with you to talk further. I think in particular, the education around, or I'm sorry, rather the need for thinking about education at the state level has stemmed from years of newborn screening work through a variety of different programs. And Kelly mentioned this a little bit earlier, but when we first started to collaborate on this project, it was a very specific ask, and that was to help develop some tools and materials that could be used to inform families about newborn screening during pregnancy. That was based on some work that we already had in the process, and we do have those tools available for any state program that wants to see them or use them. I would be more than happy to talk with you about that. It's just that when we started to talk about that, we sort of began to understand there's a much bigger need for really assessing before we start to put plans in place. And so that's what prompted the development of this survey. And I'm really glad that we did, because I think it uncovered a lot of opportunities for next steps.
All right, thank you. And those are all of the questions that have popped up in the chat right now. So I will hand it back over to the presenters if you all wanted to say anything else. And I'll keep monitoring the chat just in case we get some last minute questions or comments.
Yeah, thanks so much, Dr. Drummond. One last thing that I do want to just say, and this is certainly not, it comes at the end, but not because it's the least important by any stretch, but I definitely want to thank a number of individuals who helped make this survey come to life and helped contribute, some of which are here today and some of which are not. The entire Texas team, thank you for collaborating and working with us. Brianne Miller, who was a part of the Expecting Health team during the development phase of the survey, was instrumental to really thinking about and developing that. And then certainly, of course, all of you who did respond. I know I've mentioned that a couple of times, but we wouldn't have this data if it weren't for you all taking the time to share your insights and share your experiences with us. So thank you from all of us to you. Kelly or Amy, do you want to share anything else from your perspective, or kind of any final thoughts or takeaways, opportunities?
We just thank y'all for working with us. It's been a big eye opener for us. We've realized how important education is to everyone. Now we just have to prioritize it and find the resources to make it happen.
Well, thanks to all of you for joining us. I am going to share with you our contact information. Again, if any of this is striking a chord with any of you all listening in and you would like to talk further about opportunities to share, to collaborate, to co-develop, please do not hesitate to reach out. My email is here. We can also put that in the chat box. And again, we will be sharing the recording of this, so please feel free to pass along if there was someone else that you would like to make sure they hear this information as well. And thank you all so much for joining us. Stay tuned. We have several other additional webinars planned for this month in honor of newborn screening awareness. And thank you all so much for joining us today. Take care.